All right, welcome everyone to our 2025 quality program overview. I'm Dr. Ted Everson. I'm a medical advisor at the CPSO, and I'll be joined by my colleague, Dr. Mary Manno, who is also a medical advisor at the CPSO. And we're going to speak about the quality program options available to physicians in 2025. The objectives for this webinar are to help physicians understand what quality program options are available in 2025 to support meeting their CPSO quality requirements. And we'll go over the next steps in terms of selecting the quality program option and completing the quality program option for those that are participating in 2025. We'll start with some background on our quality programs and the current state. This slide outlines the principles that guide the work that we do at the CPSO. Certainly, we want to support physicians in providing high quality medical care to their patients, and we have tried to develop and offer quality program options that support physicians in doing that. I'll bring your attention to another principle called right touch regulation, which has been an important guiding principle for the development and evolution of our quality improvement program options since the inception and start of the QI options in 2019. And we'll speak a little bit more about that in the coming slides. Some additional information on quality at the CPSO. So all physicians must participate in a quality program, and that is based in the quality assurance regulation that guides our profession. Historically, and up until 2019, a peer and practice assessment was the only option, and the cycle interval was 10 years. So once a physician was 5 years into their practice, the peer assessment program was designed to have a physician undergo a peer assessment once every 10 years, and that was the only option. Starting in 2019, we embarked on our quality program redesign and developed and started rolling out quality improvement-based program options. And in addition, we changed the quality program cycle time to participation once every 5 years. During this initial rollout, there was still a requirement for age-related peer assessments. So for physicians over the age of 70, they were still required to have a peer assessment every 5 years. This year, in 2024, we expanded our QI-based program options for physicians over the age of 70, and this program has been called QI Enhanced. So in 2024, physicians over the age of 70, between the ages of 70 and 74, could elect to participate in our QI Enhanced program as an alternative to a peer assessment. Looking ahead at 2025, this is the final year in our initial 5-year cycle of our quality program redesign with QI-based program options. And so physicians who have not updated their quality program requirements since 2020 will be selected and must participate in one of our quality programs in 2025. In terms of right touch regulation, this is one of the important guiding principles with our quality program options that are currently available. And this is important with our QI-based options and particularly the QI partnership program. And what right touch regulation is really a framework that we at the CPSO use to guide the appropriate level of our involvement in a particular area or with a particular program. And this is based on a risk assessment. So we know that this has been an important principle for the development of our QI program options and particularly the partnership option for hospital physicians where we know there is already oversight that exists and physicians that are participating in quality and patient safety activity on a regular basis. So in terms of our current quality improvement program options, just to summarize, they're based on a right touch regulatory approach. They're based on a quality improvement design. And we now have more frequent engagement with physicians, with all of our streams being based on a 5-year cycle. In addition, there's now more choice for physicians in terms of what they're going to do for their quality program in terms of choice to select the appropriate option. And we also provide flexibility for when they're going to complete their quality requirements during a particular calendar year. This slide outlines the requirements within our quality program streams. So in addition to participating in a QI initiative or developing a quality improvement goal for your practice, there are other requirements to the program and other activities. Now, some of them are common to all of our QI program streams. So one is called practice profile, another is called self-guided chart review. All of our QI program streams have those as requirements. When we look at partnership program, when we look at QI enhanced, there are some different activities that are required. And I would say that this slide is a good reference to look at that guides, depending on the stream that you're in, what are the activities that are required. And just to note and highlight, the peer assessment program does still exist. It is an option for physicians to select into, and it still remains an option for age-related assessments over a certain age. So I'll switch gears now and talk more specifically about our QI Partnership for Hospitals program. This is an option for physicians to meet their quality requirements. And what it is that they can participate on a QI initiative with their colleagues at their home organization. How does a physician choose QI partnership? It's your hospital that initiates the process and submits a QI initiative to the CPSO for approval. Following our review and our approval, we ask your hospital to submit the names of physicians who are willing and have agreed to participate in the QI initiative. In terms of the requirements of the QI partnership stream, there's really two main components to the participation. So one is participating fully in the hospital QI initiative, as has been outlined by your hospital leadership or QI project lead. In addition, there's the requirement of completing 2 online QI activities, and physicians are given 90 days post-enrollment to complete the 2 online QI activities. QI Enhanced for 2025. So this is an option for physicians between the ages of 70 and 79 to update their quality requirements. And this is a potential alternative to having a peer and practice assessment. So in terms of being eligible, this is for someone that has enrolled in their QI partnership program at their organization. The requirements are to still complete 2 online activities. We arrange a coaching session with one of our physician QI coaches. And following the completion of all of these activities, a report is submitted to our quality assurance committee that determines next steps and whether or not a peer assessment is required. How do you select into QI Enhanced? So if you are eligible for the QI Enhanced option, you will complete the physician questionnaire that is sent to you, and you select QI Enhanced as your preferred quality program option. And at that same time, you can choose the preferred deadline to complete your QI Enhanced requirements. And there are different deadlines offered periodically throughout the calendar year that are available on a first come, first served basis. And with that, I will sign it over to my colleague, Dr. Mary Manno, who's going to speak about our QI individuals and groups subset options.
Thanks, Ted. Thinking about who qualifies for QI for individuals, these physicians are those who are actively practicing. They're under the age of 70. They are not included in a QI partnership program participating list, and they have yet to complete the CPSO's quality requirements for the current 5-year period. What do I do once I'm enrolled in QI for individuals? Well, you'll choose your preferred deadline to complete your QI activities. And you'll do that by logging into your member portal online to access the Quality Improvement Program tile and click on your active QI activity. Then you select from the available QI completion dates. And I should just point out that these range between February 1st and August 1st, 2025. There are a limited number of slots available per month, available on a first come, first served basis. What if I prefer the QI for groups option? Well, A group of up to 7 physicians can develop and submit a single practice improvement plan together. And to enroll in this option, please contact the quality team. You can do that by using the QI Messages tab in your QI activity homepage, or you can call the quality team at this number. Thinking now about QI Enhanced, we're going to talk about the enhanced stream for individual physicians. This stream requires you to complete 3 online activities: practice profile, self-guided chart review, and data-driven QI, and then use that information to develop and submit a practice improvement plan. There is also an obligation to participate in a mandatory coaching session to go over your PIP. The QI coach then submits a report to the Quality Assurance Committee, and the committee determines next steps. That is, they'll make a decision based on the information they've been provided whether a peer and practice assessment is required. This option allows for a more self-directed approach to completing quality requirements, but I should point out that participation in QI Enhanced does not guarantee that the QAC will grant an exception from peer assessment. That decision's made on a case-by-case basis. You may find this chart quite helpful in determining which quality program option is best for you, and then confirming which of the required activities pertains to that particular choice. Thinking about next steps. Key dates. This is for all QI program participants. October 16th to 18th, you can expect to receive an email about your quality program enrollment and directions for next steps. October 31st is the cutoff date to choose your preferred quality program and deadline. So key dates, and this is particularly for physicians who fall between 70 and 79 years of age. By October 31st, you will have completed your physician questionnaire and emailed it to the quality team. And by November 12th, quality staff will be contacting you about next steps if you've indicated that you prefer the QI Enhanced option. For those 69 years and under, then remember that October 31st deadline. You need to select your deadline preference in your member portal. And of course, the online portal is there for you to complete your activities and also track your progress. If you have any questions, please feel free to email us at qualitycpso.on.ca, and also we have availability by telephone. And I think that brings us to the end of our webinar, and we hope that this information has been helpful to you. And both Ted and I are in your background program here to support you as needed if you require some assistance from a physician point of view. Thank you, everybody.